Thank you, Alvina, for the opportunity to share this presentation on tracking symptoms with the CARES group. My name is Dr. Terry Armstrong, and I'm a senior investigator and deputy branch chief in the neuro-oncology branch. I lead the outcomes section, which is a group of clinicians and researchers who are focused on understanding how both the tumor and treatment impact how someone feels and functions when they've been diagnosed with the central nervous system tumor. We're also exploring ways to improve daily life and improve management of symptoms. We recognize that those with brain or spinal cord tumors may have multiple symptoms that limit their function in day-to-day activities. If you receive your clinical care in the neuro-oncology branch, you're a participant in the natural history study that I lead. As part of this study, you're asked to complete questionnaires in which we ask you to rank the severity of your symptoms on a scale of 0 to 10 in terms of severity. You complete this prior to a clinical visit or a telehealth visit. We then collect this information and share it with your healthcare provider. This includes the severity of your symptoms that occur prior to that appointment, but we also share information on how you've rated those symptoms over your last 3 visits. This allows the clinicians to see the trend in your symptoms over time, and they can make recommendations then based on what you report to help improve the symptoms that are occurring. My objective for the session today is that we will focus on understanding the occurrence of both tumor and treatment-related symptoms and the potential benefit of your tracking your own symptoms that occur. We believe that if you track symptoms, it may be a tool to help communicate how you feel, what you're doing that helps or makes symptoms worse, and help to promote improved symptom management and self-care. There are many reasons that someone with a brain or a spinal cord tumor may have symptoms. You can have symptoms that are associated with just generally feeling unwell or other concurrent medical issues such as hypertension or diabetes. You can also have symptoms that are associated with your treatment. So things such as fatigue or anxiety, daytime sleepiness or constipation or nausea can occur. In addition, it's unique to those with central nervous system tumors that the location of the tumor within the central nervous system may lead to specific neurologic or cognitive symptoms occurring. And this is solely based on the location of the tumor and not the type of tumor that you have. If you have a spinal cord tumor, you probably already are aware that there are levels to the spinal cord, and based on where the tumor is located, along those levels, you can have symptoms associated with changes in function in your arms, your legs, or even bowel and bladder dysfunction. In addition, those who have tumors in the brain may also recognize that the side that the tumor is on, the left or right side of the brain, or the lobe that the tumor is located in, whether it's any of the lobes listed here, may lead to symptoms such as weakness, changes in sensation, visual changes, or even seizures. So for each individual person, you can have a different grouping of symptoms that are unique to you based on other medical conditions, your health status, and the location of the tumor and the treatment you are receiving. Our work in the natural history study has identified that those diagnosed with brain or spinal cord tumors are highly symptomatic from the time of diagnosis. In our natural history study, 30% of those diagnosed with brain tumors have more than 3 symptoms at the time of presentation, most commonly headaches, seizures, memory problems, or difficulty with balance or walking. The majority present to an emergency room because of these symptoms, either because of the acute nature or the severity of the symptoms that are occurring. 50% of those with spine tumors in the natural history study report greater than three symptoms at the time of diagnosis. Most commonly, this includes back pain, sensory changes, and weakness, with the majority presenting to an outpatient clinic. We've also shown that symptoms can continue throughout the course of the illness and impact how a person feels and functions. Over 80% of those with high-grade brain or spinal cord tumors are unable to return to work because of symptoms from the time of diagnosis. And our work specifically in lower grade tumors, including ependymoma, has shown that nearly 50% of those folks are also unable to return to work because of ongoing symptoms. In addition to symptoms occurring at the time of diagnosis, symptoms can fluctuate or new symptoms can occur over time. One way that symptoms can fluctuate is based on the time of day. It's common for people who have neurologic or cognitive symptoms or fatigue to report these may be worse near the end of the day after being active, and improvements after sleeping at night. This type of daily fluctuation is normal, but by understanding how your symptoms fluctuate, you can plan your activities to lessen the impact that these symptoms have and what you want to do. Symptoms can also fluctuate in relation to the treatment that you're receiving. Symptoms such as nausea, constipation, or fatigue, which can occur with chemotherapy or radiation treatment, oftentimes occur at particular days during your treatment cycle. By tracking your symptoms over time, you can identify when these symptoms start and when they're at their worst. And working with your healthcare provider, you can identify strategies that may help to lessen the symptoms or prevent them from occurring altogether. Finally, those symptoms that are related to your tumor sometimes can worsen or improve based on changes in the size of the tumor on imaging studies. It's always concerning if those types of symptoms seem to be worsening. By tracking the symptoms, you can have a better sense if they're continually worsening or if they're fluctuating throughout the day. Healthcare providers become concerned about these types of symptoms when we see steady progression or worsening of these symptoms. This graph shows data from a patient who participated in the natural history study. These are the types of graphs that your healthcare provider can see. We're looking over the last 3 visits, and we can identify that this person had progressive worsening in some symptoms, including memory, but primarily these were symptoms associated with their treatment over time, and we were able to adjust it. By tracking which symptoms you're having, which ones are worsening and co-occurring, you can work with your healthcare provider to interpret the symptoms and understand what may be the underlying cause and plan accordingly. There are several potential benefits that you can experience by tracking your symptoms when at home. One benefit is to allow you to see the trends in symptoms over time that I just discussed. This is particularly important when you can track them in relation to your treatment or prescribed medications, if you just started these medications or are having trouble with tolerance. But you can also track what you do that helps and what makes it worse at the same time you track your symptoms. You may find that taking a particular prescribed medication, adjusting your diet, your exercise, or your sleep may help your symptoms. And by tracking what you're doing to treat your symptoms and the severity of the symptoms, you can evaluate this on your own and with your healthcare provider. Your healthcare provider may also ask you to track your response to prescribed treatments and your self-care plan. For example, if they prescribe a medication to reduce your seizures or to treat your fatigue or your nausea, you can track when you take the medication and the impact it has on the severity of the symptoms that you're prescribed the medication for. This can be incredibly important and help your healthcare provider determine if you're on the correct dose and the correct medication, or if other things that they've prescribed for you are helpful. Finally, it could be a communication tool that you can share with your loved ones, your healthcare record, or your healthcare professionals to update on what you're doing to care for yourself and how it's impacting how you feel and function. Some tips to implementing symptom tracking on your own is to consider using tools such as a calendar, a journal, or use of an app. Within the neuro-oncology branch, we've created an app named My Story, which is available in the Apple Store for free. We do not collect data through this app. Rather, you can track and store your own data and share it with your healthcare provider, your loved ones, or your healthcare record. If you do track your symptoms, you should consider tracking them on the day they occur. Studies have shown that anyone has difficulty remembering what symptoms that they had longer than a week before trying to document it. It's best if you can track it on the day that the symptoms are occurring or within one day. You can determine how often you want to track your symptoms on your own. You could do it daily around a treatment, or if you're having increasing symptoms, or you can monitor at a set time of day, a few weeks at a time, or even weekly if you want to follow more long-term. Remember to track self-care strategies, medications, treatments, and appointments as well. That may be important to see how your symptoms fluctuate around all of those activities. The app I mentioned that we've developed includes several tabs that you can use to record your symptoms and your activities. It includes a symptom log that allows you to rate your symptoms and functions as often as you want. You rank each symptom that you want to record on a scale of 0 to 10. You can also report how your symptoms are impacting your physical functioning as well as your activities. There's then information on what we term evidence-based self-care strategies. These are self-care strategies that have been evaluated in people with other cancers or in brain tumor patients that have been shown to be helpful. This includes the use of particular therapies, but also implications for your diet, exercise, and sleep. Within the app, there's also a care log that allows you to track your self-care activities, and you can track anything that you've decided to do or that your healthcare provider has prescribed. In addition, there's also a calendar where you can document when you have appointments, when you're receiving treatments, and when you're doing your self-care activities. This can allow you to keep everything in one place and share with your healthcare provider at the time of your clinical visit to plan for better strategies to manage your symptoms and to help you understand why they're occurring. Finally, you can also create a report based on the length of time or trajectory that you want to report your symptoms to your healthcare provider. This can be over a day, a week, months, or even longer. You can do this through your contacts on your phone, simply by preparing your report, which appears in a PDF format, and then sending via text message or email to your loved ones, your healthcare provider, or even sharing with your medical record. We tried to make this an app that allows you to track all the things that may be important to manage your symptoms and improve your ability to include self-care into your care routine. I thought it may be helpful to review an example of how tracking of your symptoms may help you in collaboration with working with your healthcare provider. In this example, Mary was seen in the clinic and reported increasing fatigue during her treatment at her visit with her neuro-oncologist. They recommended that she track her fatigue, but also her sleep over the next week, which included some time before treatment and then during. On tracking, she noted that she was having trouble sleeping, as outlined in the green, as well as fatigue, as outlined in red, after she started treatment. On review, it was recognized that she was taking dexamethasone to treat a rash and was taking this before bed. It was believed that this may have interrupted her sleep. Using the sleep hygiene suggestions that were included in the app and that Mary could institute herself, as well as changing the timing of her medication, resulted in improvement in sleep and also fatigue, which continued to improve with subsequent treatment. This is an example how, with partnering with your healthcare provider and tracking your symptoms, you can use the information to have conversations and improve how you feel. You also may find it helpful to record multiple symptoms and track them over time. This will allow you to see the relationship among symptoms, whether they occur concurrently or one may precede another. Tracking multiple symptoms can help the healthcare provider make recommendations on how to manage them when they see how they're related over time. The My Story app allows you to monitor the primary symptoms reported in our work with brain tumor patients, but also allows you to track the impact that these symptoms have on your day-to-day life. Some additional information that you may find helpful about the My Story app is that it is designed either for the person with a brain tumor or their caregiver to monitor symptoms and self-care activities. The app is available to everyone and is free on the Apple Store, and we're currently developing a version in Android. The symptoms and self-care content is also available on the NCI Connect website. So if you are not interested in using the app, you can still gain access to this information, and we hope it helps you in thinking about how you can manage your symptoms at home. If you have any additional questions, we have an email at mystory@nih.gov that you can write to us and share your thoughts or questions. In the neuro-oncology branch, we're dedicated to not only treating the tumor that you may have, but also doing what we can to improve how you feel and function. We believe that your own self-care is an important component of that. We recognize that you spend a limited time with us in the clinic or by phone, and there are things that you can do on your own to take care of your mental, emotional, and physical health, and we hope this is one tool that you'll consider. We do believe that things that you do on a day-to-day basis can make a difference for how you feel in the future, and we hope that this tool will help you to do that.
Learn more self-care strategies at cancer.gov/NCI-Connect. U.S. Department of Health and Human Services. National Institutes of Health. National Cancer Institute. Cancer.gov. 1-800-4-CANCER. Produced November 2021.